Welcome, I'm Dr. Janine, Bowring naturopathic doctor, and today I'm sharing a very fun massage. And this is an ileocecal valve massage that helps with constipation, diverticulitis, and even SIBO. So this is a great tool that you can use because sometimes there actually is a mechanical reason why you may have some digestive complaints and constipation, SIBO, and diverticulitis. So we're going to get things moving by doing this ileocecal valve massage. And let me first show you so that you can appreciate what the ileocecal valve is. So this is the connection between the ileum, so the small intestine, with the large intestine, and it happens in just about this region right here, and there's a little valve, and this is where the food and the waste is, of course, passing through, so from the small intestine to the large intestine. So if we can appreciate the actual positioning of this more or less from the model in this part of the body, and I'm going to show you exactly how to find it on yourself so that you know exactly where to do this massage technique. Okay, so for step one, what we're doing is we're finding the ileocecal valve. So you're going to find the highest part of your hip bone on your right hand side. So you can go ahead and try to do that right now. It's easier the first time to actually do this standing up rather than sitting. So ideally you will be lying down when you actually perform the massage with your knees raised so that you're able to take that pressure and that tension off of the abdominal muscles. Okay, so what we're going to do, again, on the right side, you're going to find that high point of your hip bone, and then you're going to also find your umbilicus, your belly button. And then what you're doing is you're going to connect a line, so an imaginary line between these 2 points, and where they intersect is roughly the area of the ileocecal valve. And then what you're going to do is you're going to actually press down on that spot, and you'll feel a little bit of it's a bit of a harder spot there. It's hard to describe, but when you feel it, you'll actually have an appreciation of what I'm talking about. And all you're going to do for step one is you're going to massage that area gently, little circles. I go clockwise in that spot for about 10 seconds. Now, the second step is to, again, have your fingers in this location, and now you're going to pull up your skin towards your belly button. So you're effectively moving and releasing, and you may feel and experience some sort of gurgling and things happening in the intestines when you do that. That's very normal. That means that you're actually in the right spot. So you're going to do that for about 10 times towards your belly button. Now the next step is you're going to pull across. So from the left side of your body to the right side, again, it's about an 1.5 inches below your belly button in a straight line. Now you're going to pull the contents of the small intestine, if you can appreciate visualizing that, towards that ileocecal valve. And this is great. The way that I envision this is for when things are moved and stuck and for constipation, helping to move things through to that valve so that it can actually release its contents into the large intestine, which is the next part of that digestive process. So you're going to do that about 10 times. And then the last move is you're going to sweep up. So again, from that ileocecal valve position, you're going to sweep up towards your right shoulder. So it's just an upward motion up towards your right shoulder. So the best time to do this is twice a day between meals. So not right after eating. You can imagine that's not going to feel so good. So between meals is great. Maybe, a couple hours after a meal. And this is really helpful at getting things moving. So for constipation, great, for SIBO as well, and for diverticulitis. Another thing that you can do, which I've mentioned in another video, is of course your positioning when you're actually defecating and pooping, is to make sure that you raise your legs and also lean forward. So you want to create a 35-degree angle by raising your legs, so maybe going up on your tiptoes or having a little stool at your toilet so you can raise your legs, lean a little bit forward, and that will release your puborectalis talus muscle to allow for the proper evacuation from the rectum of that stool to really get things moving the way that they should. So I hope this helps you. I want to hear from you in the comments how this is going for you with that ileocecal valve massage. Of course, you're always working with your doctor to ensure that this is safe for you, but doing things in a natural way, of course, that's what I'm all about. I want to hear from you. So please leave your comments below. Also be sure to share this video because it really is a great tool that will really help so many people. Please give me a big thumbs up as well. And if you're new here, welcome. I hope that you subscribe and you also click that bell to turn on your notifications so you always get my newest and latest uploads. And remember to always take good care of your health and do it naturally. Thanks for watching me today.